Thank you. I declare open this hearing of the Public Accounts and Estimates Committee. I ask that mobile telephones please be turned to silent. On behalf of the Parliament, the committee is conducting this inquiry into vaping and tobacco controls. I advise that all evidence taken by the committee is protected by parliamentary privilege. However, any comments you make outside of this hearing may not be protected by this privilege. Witnesses will be provided with a proof version of the transcript to check, and verified transcripts, presentations and handouts will be placed on the committee's website. I'm going to welcome this afternoon, we've got William Norton Gravett, Policy and Advocacy Manager, and student representatives Rasith, I apologise if I say this incorrectly, Jaya Sekara, Grace Bohonic.
Thank you.
Okay. Thanks for getting that on record. And Kevin Chung from the Victorian Student Representative Council. I'm also going to welcome Andrew Dalglish, President of the Victorian Principals Association. Thank you all so much for taking the time to speak to us today. Now I'm going to invite the Victorian Student Representative Council to make an opening statement or presentation of no more than 5 minutes, and this is going to be followed by Mr Dalglish, and then this will be followed by questions from the committee. Now, Grace, I'm going to hand over to you to start.
Good afternoon, everyone. On behalf of everyone at VicSRC, I would like to thank the committee for inviting us to share students' perspectives on vaping at this forum today. I also want to acknowledge that today's meeting is taking place on unceded Wurundjeri land, and I pay my respects to their elders past and present. My name is Grace, and I'm a Year 10 student, and I'm a member of VicSRC's Student Executive Advisory Committee. I'm joined by Rasith, a Year 9 student, and Kevin, a Year 10 student, who are also on VicSRC's Exec Committee, as well as William, who is VicSRC's Policy and Advocacy Manager. We want today to be an opportunity to share honest feedback and reflections, so we hope that you understand we won't be sharing the names of our schools, and we'd appreciate not being asked about this. VicSRC is the peak body for school-age students in Victoria. We're a student-led organisation headed by our Exec Committee, which is made up of 15 secondary school students from across the state. We exist to advocate on behalf of students on the biggest issues according to them. We work closely with students to learn the problems they care about most and what they see as the most effective solutions to those problems.
Everything we do is focused on the idea of student voice. Student voice is not just listening to students. Student voice also means that students have the opportunities to work collaboratively and as decision makers, alongside adults when it comes to their own education. Whether this is in the classroom, at school, or in the government, student voice means that students have a role to play in shaping what their education looks like. As for today's topic, we know that vaping is a growing concern throughout the community, especially when it comes to students and young people. Furthermore, there's been a strong focus on vaping in schools, in the media, and the responses to this by both schools and the government. To be honest, vaping is not at the top of students' own priorities when it comes to their education. Most students are far from eager to talk about other issues like far more eager to talk about other issues like their mental health and well-being, the barriers they face to feeling like school is accessible and inclusive, and the need to support their post-school aspirations, whatever they are. Nonetheless, we recognize that there are a growing number of students who are vaping, and because of this, we must find ways to collaboratively with schools and with the government to address this problem.
In the lead up to today, we surveyed some students to get their views on vaping in the context of their education. I'd like to share some key figures with you. Firstly, around 80% of students agreed that schools have a role to play in addressing vaping, which is a big part of the reason that we're here today. Around 40% of students believed that a lot of their peers were using vapes, and around 20% said they saw it a lot on school grounds. Interestingly, while around 60% of students said that they thought that their school was doing a lot to address vaping, students were split as to the effectiveness of what the schools were doing.
We believe this demonstrates that school-based solutions do exist and are effective, but some other approaches are not working. If we want to get serious about actually stopping students from vaping, there needs to be strong feelings of trust and understanding between students and teachers. Punitive measures do not promote those feelings, and usually they have the opposite effect. We can't expect students to meaningfully engage in school-based support for vaping when they don't feel like they can trust their teachers whilst reaching out for help. We have heard of situations where students' rights and their safety have been jeopardised by the measures of some teachers who take punitive actions against students who are suspected to vape. While we accept this isn't endorsed or supported by the vast majority of schools, it presents serious issues for students' safety when dealing with vaping at school. We think this represents a broader challenge, which is that teachers and school leaders aren't equipped with the resources or training they need to help students who vape in ways that genuinely work. Furthermore, we think this demonstrates that student voice plays an absolutely essential role in learning about what the most effective school-based responses to vaping look like.
The more we listen to students about what they need, the more we'll learn about what the proper solutions look like. We're pleased to have already started that work. Last year, VicSRC worked with the Department of Education to help shape its updated policy and guidance around vaping. Through these consultations, we learned from students that punitive measures in response to vaping don't work in addressing the root problem. Instead, students had a strong preference towards policies which promoted health and well-being focused responses in schools, which provided students with pathways to access external support and get confidential advice if they felt they needed it. When the policy was released last year, we were happy to see that these recommendations were reflected. But now we should be finding ways for students and school leaders to work together on finding solutions which match the unique needs of their own communities. Thank you.
Thank you. Mr. Dalglish.
Thank you. So, again, thank you very much to the committee for the invite to attend today, and I'd also like to acknowledge the traditional custodians of the lands that we're meeting on. And I'm also excited to be here with the students from the VicSRC and hear their considered views, which is incredibly important. In my role, I represent over 1,000 primary school leaders, some in P9 and P12 colleges, in approximately 1,260 schools across the state and over 380,000 primary school students. When I was invited to speak today, I went back to my board members and sought input from them, because it certainly wasn't a significant enough issue that it was being raised consistently with me as a challenge in schools. However, on that feedback, there were a number of issues that were starting to come through, and some consistency in what was being seen in primary schools, both, or not both, but rural, regional and metropolitan. Certainly the view of the Victorian Principal Association is that this is fundamentally a health issue, of which all sectors of the community have a responsibility of addressing, and certainly that schools have a significant role to play in the health education of all of our young people, and that commences early in their school journey. The feedback from across my membership tended to come through that the issue was not so much of children regularly bringing vapes to school, but either finding them in school grounds after weekend or overnight, maybe accessing them through either elder siblings or friends, and occasionally bringing them from parents as well. That then was targeted by schools in how we continue to support and educate in a way that develops greater understanding, and not necessarily in a punitive manner in a primary school sector. The feedback again has been that it seems to be declining, which is positive in comparison to last year. But again, schools are very comfortable in working with the Department of Education and the responses that they have in place, whether that be policy, whether that be program support, communication to teachers to be able to educate, communication to parents around health and how they can support, and then make sure that those structures are in place for the education approach to this issue.
Thank you. Go straight to Mrs. MacArthur.
Okay, thanks, Chair. Grace, how much does a vape cost?
From what I know, sometimes they're between $35 and $50.
Where do students get the money from to buy such a product?
I think either from their jobs or if they get pocket money.
So, Mr. Dalglish, did you say primary school students are using vapes?
I have some evidence that some are, not a lot, but the evidence that I have received back from my members is that it's been either through siblings or they have found them or taken them from home.
So they're present in their home environment, you think?
For some, yes.
So do schools have a policy that vapes shouldn't be allowed on school premises?
So there is a department policy around no smoking of e-cigarettes or tobacco is allowed within 4 metres of a school boundary, and similar if there are activities off school sites as well. So very clearly signs are displayed in primary schools, and schools will make sure if there are events outside that people understand clearly that that is not okay. Now that's not just for students, that's for visitors and or parents that are at events.
So if you find a student that's vaping or smoking, do you contact the parents?
Generally, yes. The first contact is to the parents to have a conversation with them, make sure that they're aware and offer support and assistance.
And what do they say?
It can range. Some parents are amazed or flabbergasted. Others, I have had evidence of, well, you know, so be it, depending on the parents. Not necessarily the response we would like to hear, but again, coming from a how do we support and make sure that your child is safe and healthy.
So how do you prevent these products coming onto your premises?
So as far as preventing, there's no scanning of bags or anything like that. It's really, if they're found, then it's dealt with. I certainly know from some principals, they say they will scan the grounds of a morning, especially after weekends. People come onto school sites after hours to do what they will do, whether it be playing, using the grounds appropriately or inappropriately, and that's to make sure that the grounds are safe.
So what do you think should happen to students who smoke or vape on school grounds?
So ultimately, it's, as I said earlier, that this is a health issue, fundamentally, and the role of schools, and I'm talking particularly primary schools, is around that preventative education. Certainly making sure that people understand that it's inappropriate, that it is a health issue, and that, again, they will be confiscated and work with the parents. As far as punitive responses, we certainly don't know if that's going to have the desired outcome, but again, it's working as a part of a broader community approach to deal with that education.
So rules and regulations these days on school grounds are not important?
Rules and regulations are important, but it's also how we educate students around why they are in place and then what actions can be taken. You know, we talk and we hear today around attendance rates in young people. On one hand, we're saying we need students to be at school and be attending, yet if we start to look at punitive responses, then are we sending a totally different message to those young people?
Risith, why do you think young people want to vape or smoke?
It's definitely a mix of reasons why people may take on to smoking or vaping. I believe for the secondary sector, it would be either peer pressure, because they see, oh, my friends are vaping, it's seen as a cool thing, so that may cause students to pick up vaping, or it could also be used as an escape method to escape from the stress of daily school life.
Kevin, what's your view? Why do young people want to smoke or vape?
I agree with Risith that a lot of it is peer pressure and mental health, but it's also like every student is different, and we believe that they should be treated as such, and that the response to each student should be individualised.
Thanks, Mrs MacArthur. Mr Galea.
Thank you, Chair. Thank you all very much for joining us today. Really appreciated your presentations as well. One thing I found interesting, I think you, Mr Chung, said there was a very wide awareness amongst students of measures being put in place by schools to address vaping as an issue, and that students were split on how effective they were. Ms Spenke, I think you said that was correct, the pronunciation was good, that you, though it was rare, you're aware of some punitive measures which had an adverse effect on student safety. Could you please elaborate for us what sort of punitive measures we're talking about and what sort of impacts that
I'm going
had?
to pass to William.
Mr Galea, I might intervene here just in everyone's best interest. We as an organisation have encountered a few isolated incidents of more extreme punitive measures taken against students, things like making physical contact against them to ascertain whether they had a vape on their person, asking students to lift up their clothing, their shirts, to inspect their waistbands to see if vapes were hiding in their pants and things like that. And firstly, let me say that we have been abundantly satisfied with the response from the department when we've raised those concerns, and secondly, that they aren't widespread. But in those circumstances, what we have heard from students is that they are incredibly distressing, and that they certainly have absolutely no positive impact by way of reducing their urge to vape.
Yep, yep. And on the other side of that, when you've seen positive measures, what has that looked like? What's been sort of the best case that you've seen, and any results, impacts that you've seen from that, either you, Mr. Nolan, or the students?
I'd say it's the better access for students who are facing an issue with vaping, having the access to trained mental health support staff, or even just a teacher that they can speak to about their issue or their addiction, and a channel for them to receive support based on the issue they're facing.
Thank you. Is there anything you want to add to that?
Yeah, I think there needs to be a wellbeing focused approach. So it's like focused on how their mental health is and making sure that students have this trust and understanding with the teachers.
Thank you. And interesting that you said mental health. I was actually going to ask next. I think you, Mr. Jayasakara, said in the introductory remarks about mental health that you believe it's the more important priority for students that you're facing. And we are here to talk about vaping and tobacco today. To your mind, is there much of an overlap or any correlation between students experiencing mental health issues and instances of vaping?
I would say yes. There especially is an overlap between students who are facing a mental health issue and students who do take on vaping. When it comes to schools' efforts into combating this issue, I feel especially the teacher shortage does seem to have a large impact on this. It was highlighted in VicSRC's 2023 Congress report that schools don't have enough trained mental health support staff available, which would mean students don't have an adequate support system available at their school for them to voice their concerns.
Interesting to know, thank you. And can I ask, again as a group, what sort of, if any, marketing are you seeing around vapes? Are you seeing anything on social media? Are you seeing, perhaps at the corner shop, there's some perhaps dodgy-looking products being sold, or is there any other things that you're particularly seeing beyond just word of mouth with regards to vaping?
I'd like to say that, yes, vapes do seem to be marketed in a very in a way that may be enticing towards the younger audience, especially the exotic flavors that I've seen, different fruits and sweet different flavors. I'd say those definitely entice young people and students to pick up vaping when combined with the peer pressure and the possibility of getting off the stress.
Thank you. We actually heard from some representatives of the tobacco industry this morning about, and we talked about these sorts of things with flavours and other sort of colourful gimmicks that often you'd see on vapes. Would it be fair to say that seeing things like watermelon crush or whatever it might be called, do you think that sort of makes it appear though vapes are a lot more harmless than they actually are to students?
Yeah, especially it would be because a vape isn't marketed in any way similar to a cigarette. And if a student was introduced to vaping, they would have no obvious idea that this is also a very dangerous part similar to cigarettes.
Yeah, thank you. Ms. Bernke, did you want to add something to that?
Yeah, with your other question about seeing other types of marketing towards vapes, I would say, like, personally, I haven't really seen anything marketing vapes. I think it's more just the word of mouth and the idea of teenagers and young people experimenting, and part of that is experimenting with nicotine and vaping, which is becoming a lot more prevalent in a lot of young people's lives. Sorry, what was just the question that you just asked then?
In terms of the sort of social acceptance and in terms of it being branded as something that's quite benign.
My experience with people that I know is that everyone knows that vaping's bad. Mm-hmm. And I think that having the flavours and the names of that, it's more just, it more represents fun and the idea of more experimentation and things like that, rather than distracting from all the things that are not very good for your health with vaping.
Thank you. In one of our very first hearings for this inquiry, we were actually up in the north of the state, and we had some student leaders from a big school up there, from a high school, come and tell us and share their experiences. And one of the most startling things that we heard from that particular hearing was that they said, in their experience, it was actually quite uncool to vape by the time that you're in sort of senior high school years, because it was seen as something that younger high school kids or even older primary school kids do, which was quite shocking to us. But is that a fair assessment from your experiences in your schools as well?
Yeah, I would definitely say the social divide when you get older, in the older years of school, is a lot more. You've got the people that do vape because they're addicted. No one's doing it anymore because they're experimenting and they haven't done it before. It's because they're addicted to nicotine. Whereas in the younger years, in year 7, 8 and 9, it's more about experimentation and trying it for the first time and then becoming addicted when you're in your senior years of high school.
Thank you.
And if I may quickly on this point also, this was a very interesting point that came up in our consultations with the Department of Education last year in developing their policies. And there was some discussion as to the cool factor, right, associated with vaping, and we were very interested to see a really wide variety of responses from students. Some students in some schools said that, yeah, that was a huge motivating factor and there was a lot of peer pressure, and other students said, actually, it's pretty universally considered to be uncool, or that doesn't exist. And I think that all in all really reiterates the need and the value for us to be speaking directly with students about these issues, especially when it comes to developing further policies, especially legislation, because there is not going to be a one-size-fits-all approach here in terms of what an appropriate response looks like. Each community is going to be different, and we need to make sure that we do that work.
Yeah, thank you. And can I ask, I know you're all in relatively senior years of high school now. When you were in primary school, was this an issue that you were aware of? Were any of your peers vaping that you knew of?
I would say vaping really became prevalent in around year 7, where I did see a lot of my class vaping. I'd assume is by then they seemed to be really comfortable with the vape, so I'd assume they probably did begin sometime in late primary school, around year 6.
Yeah. Thank you. And if I can ask, based on that as well, Mr Dalglish, in a separate inquiry, but an education inquiry, a primary school teacher from Northern Victoria told us that in her school vaping, or the schools that she taught at, vaping was quite common from about grade 4 and upwards, that it was prevalent but not very common from grade 2 and upwards, and not very common below that. Is that consistent with what you've seen, or is there
That's
much
consistent
regional?
with the information that I've had back. It's predominantly the senior, but starting around that grade 4, around that experimentation and what they may be seeing older children doing, and even their parents.
Thank you. And are you aware of any differences or trends between metropolitan Melbourne and regional Victorian primary schools?
No, I didn't go quite to that level around seeking information.
Interesting. Thank you very much.
Thank you, Mr. Glea. Mr. Puglielli.
Thank you, Chair. Good afternoon. Thanks for coming in. I'd like to go to this point, Grace, that you just brought up earlier around the sort of older high school cohort where you've described that there are people who would say that they're addicted to vapes and vape products. In the incoming legislation from the Commonwealth that's coming into place for adults, they'll be able to buy a vaping product at a pharmacy, whereas for people underage, you're going to require a GP prescription for a product like that. Now, given that there are people that you're describing who would say that they're addicted to these products, if they're unable to access a GP prescribed product to fulfill that addiction that they have, do you think we currently have adequate support services for young people who might be experiencing withdrawals from these products, who are maybe needing help with cessation? Do you think the supports are currently adequate?
If I'm going to be honest, I think that from what I know and from my experience, vapes are very accessible to buy. And if it's not possible for someone who's addicted to nicotine to purchase a vape without going to the GP and just going to, I don't know, the local corner store and getting one, I think that there's lots of other ways to be able to access one, whether that's through older people, going and buying one from the chemist for you. And to your point about,
So is your concern perhaps that then, rather than taking a sort of support pathway to move out of the dependency, people will instead turn to other avenues to find a replacement product, even if it's from the illegal market.
Yeah, big time. And sorry, what was your question about?
Yeah, so it's just for this cohort that you've described that would say that they're addicted to the products. Just what supports do you think we need to see for those cohorts, particularly the older high school years, to ensure that we don't see a whole lot of young people experiencing withdrawals from these products while they're trying to go through their exam years at the end of their high schooling?
I think that the school-based response to vaping, like Andrew said, it needs to be more health focused rather than behavioural issues, and having qualified professionals in schools to help with vaping and help those students with the addictions would be really helpful, rather than just going to the illegal market to buy a vape. Sorry, I don't think I phrased that very well. But.
No, that was great. Anyone want to add a few more comments?
I'd like to add something on to Grace's point. Punitive measures that a lot of schools currently employ erode the trust between the students and the teachers, and especially he would discourage students from speaking up about their issue with vaping and talking to a trusted adult because they could fear getting a punitive action made against them. A lot of the teachers aren't equipped with the proper skill set to address vaping issues, and they aren't properly trained onto what to do in a situation where a student was to approach them with an issue with vaping.
I think also we need to make sure that students have access to information, that they can have like external support services and like other avenues that they can go, which like including making complaints so that they feel more comfortable and like can seek this help.
Sure, thank you. In what ways do we think that media literacy can be improved for young people, so to help them sort of recognise if they're seeing advertising trying to sell a vaping product, recognising what that is and avoiding the influence from those vaping ads?
Is there any way that you could rephrase what?
Yeah. Sorry, no, that's my bad. So basically, we've heard from the cigarette companies earlier today. They're saying they're not intending on their ads being seen by people underage, unless there are individuals here who say that they have seen them. It sounds like there are young people who are seeing these ads. So I suppose in what ways can we help create education programs to recognise that that's an ad? It's trying to sell me a product here that's, the company themselves are saying isn't intended for me. What pathways should we be setting up to recognise what that is and to avoid being persuaded by that kind of material?
I might jump in here. I might say that I'm not necessarily convinced that the solution is increased media literacy among young people. I think that the vast majority of young people are incredibly media literate. I think the solution probably is in tighter rules and greater enforcement when it comes to the advertising of these products. Because I think, as we said before, if we are going to embark on this on a project to increase media literacy among young people, we need to find a way to make sure that we're reaching all of the young people that we need to be reaching, and that is an incredibly complex endeavour. It's a virtuous one, absolutely, and I agree that it would be valuable. But I think that we ought to start with taking firmer control as to how these tobacco companies, for example, can reach young people.
Sure, thank you. For sort of vaping and smoking education programs, is there a view here that we should be co-designing those with young people, and what might that look like?
I think it's absolutely essential to co-design education around vaping and the harm that it causes with young people and with students, because ultimately if it's not engaging, then students aren't going to learn that much, not going to be able to take it away into their daily lives. I think it needs to be done so that it's with an inclusive pool of students and not just the same 3 or 4 students. And that's a tricky task, but not every student is the same, not each student community is the same, and it needs to be a diverse range of students.
Sure. Do you have some examples of sort of co-design processes that maybe you've been a part of that might be a good example to draw from in relation to these sorts of programs? You can talk about Vic SRC that you're involved with if you want.
I'd be happy to. Look, we're running a number of really wonderful programs engaging directly with the Victorian government across the board. You know, this year we established, whether it's senior secondary reform, we have our student advisory panel there that are doing excellent co-design work in terms of the, funnily enough, the sort of media and communications elements of how we educate young people about what their options are in senior secondary. In the mental health space, we're working very closely with the department to figure out, again, in the media and the communication space, how can we increase awareness among students of the options that they have available to them, the pathways of support that they have access to, because resoundingly the feedback we get from students is that regardless of the quality or the quantity of support available to them, in many circumstances the awareness is really low. And so we've established another group of students there working, again, directly with the department. And these are really great examples of how we can bring together students and policymakers to make sure that students have that opportunity to co-design and collaborate on education policy.
Great. Thank you. Thanks for coming in. Thank you, Chair.
Thanks, Mr Puglielli. Mr Tack.
Well, thank you, Chair. Thank you for coming today. I'm more interested in the education part, awareness that you said. In terms of education part, should the vaping and smoking education program, when you mentioned before, you participated in the co-design with young people. So should vaping and smoking education program be co-designed with young people?
I would say yes, especially because it's definitely hard for a bunch of adults to be able to effectively communicate with essentially young people. So it's definitely vital that young people who will be on the receiving end of those programs are part of the co-design process and have a say of how these initiatives are... Sorry, I lost my...
No, it's okay. It's all right.
The short answer is yes.
Thank you.
If I may, Mr Tagg. I think it's really important when we're working with our young people around co-design that the language used and developed is very specific, that we're not talking about shame and embarrassment for those who may be using these products or addicted, because more than anything that will push it underground and people will, particularly young people, will disengage even more.
Yeah. Thank you very much. I thought you already answered my second question, but perhaps go to Kevin, because you said that you involve survey in your school, and 80% come back about, one school to get involved in terms of understanding more vaping and smoking. With that co-design resource, what were the outcome that you can see?
Sorry, could you rephrase that?
The positive outcome from that survey.
It's like the...
I think, allow me to clarify, because we put out a call in advance of this appearance to students to complete a survey on their attitudes and perceptions about vaping. So I believe you're referring to this figure, 80% of students who agreed that schools had a role to play when it comes to addressing the issue of vaping. So that's actually across the board from a number of both public and private schools. And I think it's reflective of a really strong appetite among students for their schools to play that role, to provide that environment of support when and if a student feels that they need it, to engage with, ceasing vaping when they make that decision.
Okay. My last question, though, in terms of as a parent, I'm very sort of lucky that this is part of this inquiry, which before that I knew very little about vaping and, at school and all of that. So how can parental involvement in vaping prevention be increased? Or should parents get involved at all?
I think when we're talking co-design, certainly having students, families and educators working together gives that joint ownership and therefore greater opportunity or chance for success.
Yep. Sorry, I thought more in terms of prevention.
Yep.
Should parent or how can parent get involved more in terms of,
It's a good question, especially when parents have very, very busy lives themselves.
Yeah, that's right.
Whenever we're talking, though, about health issues. It is engaging as much with the parents as it is with the young people. So it's educating at the same time around the dangers of these products to ensure that they've got the knowledge as well that they can share with their children, have a consistent message.
Yep. All right. And do parents view vaping as a significant issue?
Probably not the remit of the questions that I've asked my members, but talking as a parent and a grandparent, I'll say yes. And that's as a personal view.
Okay. Do we?
Well, Vic SRC is the Student Representative Council, so we're not too sure what parents' views are. But I know it's definitely a concern for my parents.
I'd like to echo that statement again. If I were to have an addiction to vaping, I know my mum would be quite horrified.
You're putting that on the record here?
Yes. Going back to another point I'd say is that students are much more likely to listen to one of their own peers, so it's very vital that we have a co-design process in place for engagements with students about issues with vaping.
All right. Okay, I guess that's all my questions. Thank you.
Thank you, Mr Teck. Mr Hilakari.
Thank you so much for appearing this afternoon. It's really appreciated. And this is part of co-design, of course, in having yourselves here and yourself here. I'd love to just to take on notice as a starting point the survey results that you received, and would love those to be shared with the committee if that's okay. And I'm just wondering, what was the number of people that responded to the surveys? Because that's always the first question that we want to know about a survey.
Absolutely, yes. So I will tell you that was a preliminary survey. So our group of student executives, that would be 15. But I think it's reflective of the fact, though, as we heard from Grace, one of our executives in our opening remarks, vaping is not at the top of students' lists.
No, I took that as a starting
priority. Yeah,
it's at the top of the list for this committee's work.
Indeed.
Today.
Indeed.
No, yes.
Yeah, and so if we put a survey out there, I'm not sure how many responses we'd get. Interestingly.
Do you have any intention to do a wider survey? Not to put you on the spot in this moment, but I am.
We don't have an intention to do that.
Great, okay. If you could share the results of the survey, that'd be brilliant, and thank you so much for participating and adding to that richness. In terms of, I just want to talk a little bit about accessibility to start with. So I'm going to be asking about your own experiences, but obviously don't talk about your school and all the rest. So within walking distances of your own schools, and you're a school principal at the moment?
Not at the moment, no.
Not at the moment. So maybe just talk about the previous school that you were at as well. What's the physical accessibility of vaping, places where you can buy vapes within the distance of your existing school or your previous school?
My school's in the middle of farmland, so that might be a bit tricky to walk somewhere from my school to buy a vape.
Yes.
But
we'll say very low, but in terms of your accessibility, getting to school, whether that's in town, nearby, high level of accessibility?
Within the communities around my school, I would say, yeah, it's pretty accessible.
And for young people, so people who are clearly under 18?
Yeah, I'd say it's still quite accessible.
Great.
Yeah. I've been into a few schools through my secondary education so far. I would say for a majority of those schools, access to vaping and vape devices has been quite easy. I'd say the nearest town usually does have a smoke shop or a vape shop or a chemist somewhere where students can easily access vaping products.
Great.
Certainly just my observations, just the accessibility of smoke shops and so on. Regional communities, metro, yes, but not so much some of our smaller rural communities. But certainly, again, listening here, probably more accessible than I even thought.
Yeah, I'd echo everything. It's pretty accessible to a lot of students.
You could, off the top of your head, describe a store in your community where you could go and get a vape anytime, I'm imagining?
Probably.
You know of one in your head?
Probably.
Great. I suspect that's the case in almost every community. Beyond bricks and mortar, are you aware of people receiving vapes in any other method? So beyond walking into a store, have you heard of or do you know of any other ways that people are accessing vapes?
I've heard of students importing vapes and then selling them, but I don't know if you can do that anymore. I don't know. That was a few years ago.
Years ago?
But-
Yep.
I think just getting it from friends.
From friends is, yep.
Yeah, I've definitely seen a similar thing to where I said that students are importing or buying them online and selling them at school.
And as people, we did hear from students up in the north of the state previously, and they did sort of talk about that, sort of a bit of a curve of, people starting off vaping, hitting a bit of a peak and then going down as it was, considered uncool. What do you think has led to that being the case? Like, what presents it as being uncool at a certain point in time?
I would say, again, as Grace mentioned in a previous point, it's definitely the fact that the teenagers are experimenting with nicotine and different pathways to manage stress or to be seen as cool. I'd say a lot of teenagers is, from my experience, really focused on their social standing during those years, during middle secondary, early secondary, but towards senior secondary, the idea of social standing is really reduced, and it's really just, I want to get through VCE. So I'd say that's what really drives vaping becoming uncool.
Can I just ask you, just in follow-up, I thought that was a really good question and answer. Why do students think that vaping manages stress?
Because I feel like it's the social aspect especially, because vaping is seen as a social activity from my experience. It's definitely something from peer pressure, but I believe it's also the nicotine rush that would make students feel, it takes the edge off the stress, really, that students feel from assessments and really in the early to mid-secondary age range.
And might I add just very quickly, I'm reflecting on some things I heard from Grace in one of our conversations last week, where she told me a little bit about her observations in terms of the impacts that an addiction to nicotine has on students in the classroom, right? In terms of difficulty focusing and the fidgeting and all of that. And I think that part of this drop-off is probably students who deal, with, they are brought in by the allure initially, but then all of a sudden are exposed to dealing with these challenges of addiction further on, and then all of a sudden that allure is gone. And so I think that what Grace said to me really reiterates the fact that this fundamentally is a health issue, and it's a very serious one, where young people are dealing with addiction in the classroom and withdrawal as well, and further reiterates the importance of taking that health-focused response within school settings.
And just in terms of health-focused response, have you had anyone that undertake some services like involvement in the quit services or the quit line or those sorts of bodies? Do you know if there's accessibility to the information about those services? Have you ever seen them before?
No, none. No one I know has taken a part of those services, and my friends try and quit. I don't think they would have ever crossed their mind.
Yep.
Yeah.
Do you find that information is freely available to yourself and your friends?
I don't think, from my experience, I don't think that it's a very common idea and something that's thought of to be an even option for young people. I'm not too sure. It's never really been talked about.
And within your own schools as well?
Yeah, I'd like to say that a lot of students would see Quitline and those other services as something more aimed towards cigarette smokers and the older population rather than the younger students who are addicted to vaping. I feel like a lot of the students who do engage with vaping aren't aware of any support services available to their specific age range or they would be able to relate to.
And I just wanted to add, the advertisements that I've seen on Snapchat and TikTok by the government to help telling young people to quit vaping, none of it's about getting support. It's just it's like if you have to do it in the bathroom stalls, why are you still doing it? It's not about reaching out for help. It's more just about quit.
Yeah, yep.
From my experience, I think these support services, it's both students have a stigma that they just don't want to go to that, and that they don't think it would be effective for them, or that they just don't know it about it.
Yep. So there's maybe a lack of knowledge, awareness, and hitting the right mark in terms of speaking to young people. Well, that's some good co-design opportunities as well. In terms of principals, and I know there is a huge amount of other pressures of time and importance about the communications that you use, because you've got to communicate a whole bunch of information to parents and students. How does vaping and quitting vaping or support around vaping register in your view on that sort of list of priorities? Is it way down the bottom, or is it somewhere in the middle? Or
certainly in primary schools, it's not seen as a major issue. It's more a peripheral one,
Yep.
and it's dealt with on probably an ad hoc basis when it comes to dealing with perhaps those children are using it. I mean, it's more that prevention through the education
Yep.
processes that start right at early childhood. So it's not one that I'm seeing as a high-level one in the primary sector.
Yep. And in terms of, do you think where the government's getting it right in terms of the supports and information that's available to principals?
I think there is quite a large range of supports available, certainly through the department's policy portals and information, which layers through and targets, say, the primary school sector, but then it goes through into quick line, into health, into translated information and so on. So it's quite in-depth what is there. Again, I can't comment specifically on secondaries, but primaries they definitely look more at that education process and starting earlier on around that tobacco and then vaping as well.
Might want to ask.
Yeah, I'm just interested to know, I know that you just said that primary school is really about prevention, getting them before it starts. What age for a student would you start the conversation in primary school around what's healthy to put in your body and what's not for this?
Starts pretty much at foundational prep year. So if you're using life education van and so on, it's talking about healthy food, but then anything else that may be unhealthy going in. So those programs will deal with pain-killing drugs such as paracetamol and so on, cough medicines and so on, and then we'll start heading more traditionally into tobacco and things like that. So it does start at quite an early age.
Sorry, Chair, what is ages early?
5 and 6. 6 at commencement of primary school.
That's really something, isn't it? And in terms of in your own schools or schools that you know of, have you been aware of any smoking, vaping detectors? Are they widely used within toilets and toilet blocks? I've heard of these being used. Is that something that's widely used across schools?
So my school just recently got some vape detectors, and it's been really interesting to see how the bathrooms have changed and how people vaping, how that has changed within the school. Because it wasn't all of the bathrooms that got them, it was like 1 or 2. And I think it's a really great way to deter people from vaping at school and vaping in the bathrooms. But it doesn't solve the issue of stopping vaping. It just stops people from doing it in that specific space.
People are vaping now, I don't know, behind the school shed or, yep.
Yeah,
Okay.
But I do think that it's been really effective at making it so that the bathroom is a place to go to the bathroom.
Great.
Yeah, and I'd say one of the schools I attended, they didn't install vaping detectors. I was speaking with one of the students there recently. They still haven't installed detectors. One thing they did though, and I've seen done in a lot of Victorian schools, is that they lock the bathrooms during the day and they're only open during lunchtime and recess. That's a terrible measure because that means students don't have free access to bathrooms or any of those facilities purely because of the few students who are vaping. And I feel like that is more teetering on a medical issue as well, because students who do have that requirement and to have access to a bathroom are being denied that.
Is that an experience that you've heard of in other schools, of
Lots
bathrooms
of
being
schools,
locked?
lots and lots of schools.
Okay.
We certainly have heard that, as well as other measures like deploying teachers out to patrol bathroom areas, which again we heard was a bit of an oppressive measure as well that can sort of compromise that feeling of safety there. But I think, yeah, absolutely, Grace and Rizith are completely right. A vaping detector, if it keeps a bathroom open, is something, but it does nothing to stop a student ultimately vaping. If they want to vape, they'll vape.
Do you have a view on what's leading to potentially bathrooms being locked? Is that something that has been discussed?
Certainly not in primary school sector. Again, as I've mentioned earlier, we don't tend to have that kids sneaking off to the bathrooms to vape. It's more done as a experimentation side of things. So, no, not particularly.
Can I just ask a question? How do you get rid of your vapes? What do you do with them when you're finished?
A lot of people just keep them in a box in their room, but I think you just chuck them out in public places is mainly the thing. And that's why hearing that they're at primary schools on the grounds just makes a lot of sense.
Do you think that students are aware of the environmental impacts with the lithium batteries inside the vape? So basically, you know, if they're vaping and they continue to vape, the amount of lithium batteries that are being made and sold illegally, how we dispose of them and how dangerous that is.
Did not know that.
Do you think that would have an impact, particularly on young people who are very much aware around the environment and climate change, the impact that lithium batteries have, say, at the local tip and things like that?
I'm not too sure. I think you'd have to ask a wide range of students and do a bit of student voice.
Look, I think it would be an effective measure, and I think it would work, but it would be very important that it went along with the broader work to ensure a safe environment, let's say in a school, whereby if we're going to, let's say we effectively educate students as to the environmental impacts of disposable vapes, and we provide them with some means to dispose of them properly, a student will not make use of them if they feel that there's any risk of them being found out, being caught, whatever. They need to have that sense of trust that they can do that, you know, and they can make use of those facilities, especially on a school ground, because otherwise they will just chuck it in the bin or whatever because they don't want to be seen, they don't want to be caught.
Thank you.
The other question I have is in relation to, is there any sort of education awareness or even concerns? You know, we talk about vaping to be seen as cool and trying these things out. And I remember when many years ago now, though it doesn't seem like it, when I was at school and all of the things that we tried.
We're about to get some insight into the chair of the committee right now. Be prepared.
Do you think there's education awareness, obviously about the nicotine, it being addictive and the types of terrible diseases and eventually potentially death it can lead to and the type of death? What about, because they're illegal, they're coming in illegally into the country and they potentially do have substances other than nicotine in them that are poisonous, and because it's not regulated, it's not legal, you don't know what's inside them. We did hear evidence from a school where a poor young student, and I'm sure he's never done it again, I think in primary school, had tried to vape for the first time, completely wigged out, and went to hospital and was quite unwell. Is there that kind of concern? Do people realise that because it's not legal, the substances going into the vapes is more and can be more than just nicotine, and it's not like buying over-the-counter, you know, packets of cigarettes?
Just from my experience, if a student is driven to vape, then like generally they wouldn't be like concerned too much about that. But there definitely needs to be some more like education put out there, programs that like do tell these students that here are the negative impacts of vaping and what like buying illegal vapes can like what the impacts of those can be.
And if I may too, I think it's important that we recognise the magnitude of the challenge that students face when they have an addiction to nicotine, but specifically an addiction to nicotine that is derived from vapes, whereby the amount of nicotine in those devices might be hundreds of that of a cigarette. And so much is said about the enormous challenge that a person faces, you know, when they try to quit smoking, traditional smoking. I can only imagine how intense those feelings of addiction and withdrawal when you don't have it would be when you've only used vapes before. And so, as Grace said before, from my perspective, I'm pretty confident that most students have a good understanding of the fact that there's all sorts of things in these vapes. I think they get that. But they're deeply, deeply addicted to nicotine by virtue of these devices. And I just don't think, when they weigh it up, I just don't think it's enough of a motivator, you know, when you're in the midst of an addiction like that.
What about prevention back at your end, Mr Dalglish?
It's almost part of, if we look at that broader social challenge when we have around illicit substances. People will still take them regardless of age, depending on circumstance, whatever they're doing. And I'm not sure necessarily that continually hammering away and educating around the dangers of these products is going to hit the mark. Again, we've heard these fine young people talking about, you know, when students get to that senior secondary college, they've gotten through that experimentation and, no, this is where I want to be. Again, listening to our young people, what does co-design mean when there's an ownership in it? So I'm not sure if trying to continually say, you know, we know there's some really dangerous things in there, but is it going to change the view of someone who thinks, oh, well, I'm under peer pressure, or I'm just going to experiment and have a go? Will it actually stop them from doing it?
What about if they saw ads that show there's rat poison and rat faeces in these illegal products? Would that hit the mark, Grace?
I think the idea of seeing rat faeces being in a vape sounds disgusting.
Would it put you off?
Yeah, but I also think, like, in the moment, you're not thinking about that. If you're at a party and someone's just offered you a hit of a vape, you're not thinking, oh, lithium batteries, rat poison. Like, that's not where your head's going. So I don't know, to be honest.
Yeah, and I would like to add that when you mentioned that a lot of the vapes are being imported illegally and these are unregulated, I am aware of that because I have been doing some personal research into it, but I'd say a lot of students aren't aware of this. It's not widely known in the student community, nor is it spread, and where students are definitely unaware of the dangers of the ingredients inside of these vaping devices.
What about if you had a poster in the toilet that showed you're ingesting rat poison? Would that help you?
The posters, I think, within the bathrooms at the moment, it's like got cartoons on them and they're just like, vaping's bad. They're not very
Oh, we need a bit more hard-hitting, do you think?
I'm not too sure, to be honest.
Vaping versus traditional cigarettes. Do you want to just talk about what you think the sort of percentage breakdown of usage amongst people you know is? Does anyone smoke cigarettes at all? And then, if not, why do you think that's the case?
People that I know that are my age smoking cigarettes are doing it to quit vaping.
You're smoking cigarettes to quit vaping?
Yeah.
Much less nicotine.
Yep, much.
Illegal tobacco?
Illegal.
So, obviously purchasing the cigarettes is very, very expensive. How are they accessing the cigarettes?
I'm not too sure, to be honest. I know for a lot of people and for my friends, it's just their parents smoke.
The parents supply it?
I think it's just stealing them. Well, not stealing them, but just taking them.
Sharing.
Kevin, I might ask you as well in terms of the percentages of
I
tobacco vaping.
I would say that I have never seen somebody in early to mid-secondary age levels to smoking cigarettes, because it's really seen as something uncool of like older generations, which is ironic when people think that vaping is cool. I'd say I haven't seen anyone smoking traditional cigarettes. It's really all e-cigarettes and vaping devices.
It's pretty much like all vapes that from experience. It's like just the cool factor and the social pressure to go vaping. And I don't know, it's just not there for the cigarettes.
And Mr. Dalglish, across schools, are you getting reported that there's any cigarette smoking?
No, it's more the vaping. Again, bright colours, finding them on the ground, the flavours.
Yep, great, thank you.
Okay, I think that's, did you have an?
Yeah, I'm just wondering if you know of any evidence, anecdotal or substantive, that might suggest if students are more likely to be vaping in a household where there are parents or others smoking or vaping?
I'm certainly not aware of any such evidence myself. No.
Okay.
Not evidence. Anecdotally maybe, but not hard evidence.
Okay, I think that's the end of questions from committee members today. Thank you so much for taking the time to just come and talk to us and share your experiences and share experiences from from parents, principals to students. It's really valuable information, and you all spoke so well, very brave. Now the committee is going to follow up on any additional questions or questions taken on notice in writing, and responses are required within 5 working days of the committee's request. The committee is going to take a very short break before recommencing the hearing. I declare the hearing adjourned.